What is up, everyone? Welcome back to the Geek Weekly podcast. I am your host, Leslie, and today's very special guest is Ashley Moore.
Hi.
Hi. She is an epidemiologist with the State Health Department.
That is correct.
How are you?
I'm doing well. Thank you for having me. How are you?
I'm good. I'm excited.
Me too.
Okay, so can you tell us a little bit about what you do?
Sure. So my day-to-day is kind of different every day. As an epidemiologist, we are responsible for the surveillance and monitoring and prevention of infectious diseases,
Mhm.
um, as well as other types of diseases, chronic disease like diabetes and things like that. We collect data on those. We provide that data to policymakers, and they implement programs and different policies to kind of address those issues in different communities. So we're kind of the data behind public health.
That is incredibly cool to hear about. How do you how do you go about retrieving the data?
So every hospital, doctor's office, medical person who sees patients and gathers information on those particular patients has to report what we call notifiable diseases to us.
Mhm.
So those could be anything like COVID, for example, to what I study, which is meningitis, um, and to different chronic diseases like diabetes and things like that, and things such as HIV. So there are diseases that are considered a public health concern. And so those diseases are put on our list, and we require that anytime a person develops that disease or is diagnosed with that disease, that it be reported to the state health department.
That is incredibly interesting to get to hear about that you help it all come back it all comes back to you and then you help report it to the state.
Yeah, yeah. Yeah, so once we collect information that helps us decide who is being affected by the disease, like is it mostly men, is it mostly women, is it children, is it adults?
Mhm.
Um, is it any particular subpopulation of people um, that could be vulnerable to this particular disease? And alongside doctors and nurses and our clinical partners, um, they gather information on the individual patient, like height, weight, that type of stuff that could be beneficial or could be helpful in identifying any underlying conditions or risk factors associated with a particular condition. um, Certain groups, certain people, like folks that have a compromised immune system, may be more likely to develop a particular disease. Some of my diseases, for example, tend to affect the immunocompromised more.
Mhm.
So, um, we can issue special guidelines like, uh, you know, preventive treatment, to kind of prevent them from getting sick in the first place. So that just kind of covers what I do in a nutshell.
That is really interesting to hear about because I don't know, I feel like you hear a lot from like doctors and like for an example, like I guess in school you hear a lot more about doctors and not exactly the people who kind of help report behind them in a way.
Yeah, you're exactly right. Like, it's funny. when I was in high school, even, of course not in middle school, I had no, like, I wanted to be a doctor at one point until I realized emotionally I couldn't handle like losing a patient. So I was like, yeah, no, this is not for me. Um, but I had no idea until it wasn't until I got to graduate school that I realized epidemiology exists as a profession.
Mhm.
And I absolutely fell in love with it. So, I tell um, people that I mentor, like, don't be afraid to change course over your educational career. Like, you might find that what you wanted to do in undergrad may not be what you want to do in grad school if you go to grad school, or what you do in undergrad, if you choose to go to college, um, may not be what you want to work at for the rest of your life. So,
Mhm.
it's okay to change your mind, absolutely, and to explore new things. But I have fallen in love with epidemiology and the field that I'm in, and just I really enjoy it.
That's sorry.
No,
No, I love just hearing about that because especially what you said, that you mentor people and help them kind of, because some people, I, I know switching your major in college a lot. Like I know a bunch of people who have switched their major a ton, and hearing that you can still like switch it up and still like become an epidemiologist is incredibly interesting.
yeah, I I joke that you're never too young to have your midlife crisis. Like, you absolutely can change your mind about different things. So um don't don't feel like you're wedded to one thing. I mean, it does suck if you go through all this education to get a, a degree in something that you aren't passionate for anymore, but it's better to let it go and go for what you're passionate about than to stick with it and just be miserable.
Yeah.
So, yeah.
No, I totally agree. I think people should absolutely, if they're unhappy in like the field of work or the field that they are majoring in or minoring in, they should switch it and find something that they enjoy more because this is what they're going to be doing with the rest of their life.
Exactly. Exactly. I mean, why not do something that you love? And if you happen to get paid for it, all
Yeah.
the
So, what did you study in school?
So for undergrad, I studied biology.
Mhm.
And for a long time, I thought I was going to be a marine biologist, which was really silly because I can barely swim, and I don't really like being out on the ocean in the middle of nowhere.
Mhm.
Um, so that wasn't exactly the best, but in my head, something was cool about being able to study dolphins and other marine life, but it wasn't meant to be.
Yeah.
Um, I went to grad school and was going to work as a forensic scientist. Um, and so I took a lot of classes. I got an additional master's degree in applied and environmental micro, and was going to work in a lab, and that was going to be my job, and I was going to solve crimes and help free people that had been wrongfully convicted and all
Mhm.
kinds of stuff, and send bad people to jail. But the reality was I hated being in a lab. It
Mm.
was lonely, it was boring, and just didn't suit my personality. It was very repetitive, um, and I didn't like it. And here I am in grad school, like, having a crisis of heart about what I'm going to do for the rest of my life. And I happened upon of mine who actually became my advisor,
Mhm.
and he was like, "Hey, you have all this science background. Have you heard about public health?" And I was like, "No." And she was like, "You definitely should try it out and consider it. I think you'd be a great fit for epidemiology. Um, it's a really cool field, and you won't, quote, unquote, "lose" all of the science you have." So, I was like, "Okay." So, I, went to, like, a seminar for it and was just absolutely fascinated and loved it and applied and got my master's in public health and epidemiology as well. So that's kind of my educational background. So I have my undergrad degree and a couple of master's degrees.
That is so I've always been interested in, forensic, studies.
Yeah,
I think that's
it's
incredibly cool.
it's a cool field, and it's a field that definitely needs people that are passionate and dedicated. Like, but I did an internship in undergrad with the Atlanta Police Department, and
Mhm.
it really is not as glamorous as the TV shows make it seem.
Mm.
So that kind of was a little bit of heartbreak for me because I was like, I thought it was going to be cool and you solve the crime. And I mean, it takes months to solve crime, and then it has to work its way through the legal system, which is a totally different animal. So, um, yeah, I definitely was disappointed, by how not glamorous the job was, but, for people that love it, it can be very rewarding.
No, that's insane. Like, I get that, like, jobs aren't as all what they see on TV, but that
Yeah.
one I thought was pretty close enough, but apparently not.
Yeah, no, surprisingly, no, like, some of the stuff that they and it's funny because the police and, the forensic scientists, they know what is being how they're being portrayed, and they kind of joke and laugh about it because they know that's not the reality. Um, like, and it's not, you know how you seem like you're the person that collects the sample and then you take it back to the lab and analyze it. That might be 3 different people in reality, as opposed to the same person doing all those jobs. So, you might not ever if you're in the lab, you might not ever see a crime scene. Um, but then again, maybe you have to go out for something. It just depends, but it's typically the people in the lab, they're in the lab, and the people that are, evidence people who collect evidence are usually associated they could be associated with the lab, but they're usually associated with the police department. So that's police training you would need to go through. So, and not everybody wants to go through that type of training.
Mhm.
So, um yeah, yeah, it wasn't what I thought it was going to be, but
No, I mean, I personally do not wanna I had considered becoming maybe something in that field, like, a couple of years ago, because I just thought it
Mhm.
was interesting. Because my grandparents always are watching, like, those type of shows, like, their
Yeah.
favorite shows, like NCIS type thing,
Yeah. Yeah.
and I thought it was interesting, and I considered it, and I personally do not wanna go through any type of officer training at all.
Yeah, yeah, yeah. That wasn't my ideal situation either. So that's kind of like, yeah, this clearly isn't the career for me, and that's perfectly fine.
Yeah.
'Cause I found one that I absolutely enjoy. So
So you may have gone over this somewhat, but how did you decide that this was your final career path? Like, this is what you wanted to do?
um so essentially part of it was in grad school. Um and I mean, I've always been like a nerd. Like, I've loved school, I've loved everything about it. I love, well, maybe not so much the homework, but I loved going to class and just doing presentations and all of the fun stuff. And what we were learning about was so interesting and so relevant, um, and it could be as interesting as, why, this person gets a disease and why this person doesn't. Um, and trying to figure out why that is. It was just really cool. So school and the professors I had made it really exciting and really interesting. And then when I started working for the health department, the state health department here in Georgia, I fell in love with the work I do every day. Some of it is, tedious and not fun, but it has to get done. But some of it is interesting. Like some of my investigations, they're almost in a way like crime scenes. You have to figure out how this person got sick. You have to figure out which people are connected to them so that you can make sure they get appropriate medication to prevent them from getting sick,
Mhm.
to try and stop the spread. It's like a race against the clock, essentially. And I get to work with our partners at CDC and at the local health departments. And it's really fun and exciting work every day. And every day is different. Um, but I thoroughly enjoy it. So that was kind of a long way of answering your question, but
No, but you completely covered my question. I love that answer. So, how has your career changed since COVID?
well, one enormous change is we are all now essentially permanently work from home. We used to all work in a big building downtown called Two Peachtree,
Mhm.
uh, and we're still there temporarily, at least. But we don't go into the office every day, at least not most of us. So that's one big difference. Um, Another big difference is, I would say public health has kind of been, I mean, I hate this phrase, but it's kind of the best way to describe it. It's kind of been the redheaded stepchild in terms of funding.
Yeah.
Um, like we don't always get, the support we need to do the job that we do. And when you do a good job, you don't know that we exist, which is kind of a downfall. Like, when a doctor does a good job, he cures a patient of something and it's something tangible that you can point to that the doctor has done. But if you prevent 5,000 people from getting sick by, you know, shutting down a restaurant that was, serving something that was making people ill, then you may not get the recognition that you deserve,
Mhm.
it kind of like that. Like if you prevent something from happening, no one ever knows it happened. So it's hard to claim credit for it. Um, which is why public health is kind of a victim of its own success. I mean, things that you don't realize are public health, like seat belts, for example. Um, Without them, the motor vehicle accident death rate would be a lot higher than it already is.
Mhm.
Um, and some people don't like them and refuse to wear them, but they are public health and they are an essential life-saving device if you're ever in a crash. um, there are tons of examples, from clean water to clean air act, things that help you drink clear water and breathe fresh air,
Mhm.
as opposed to what was going on during the industrial age when companies were pumping out smoke pumping out smokestacks of plumes of toxic gas that was just killing everyone. We've helped prevent all that, and people that have come before me have helped create legislation and policies that have, you know, really improved and elongated the lives uh, of most of, American citizens. And even beyond that, public health isn't just in America, it's across the world. So, global citizens as well have reaped the benefits of public health, but we don't always we don't always get recognized for that. COVID changed that a little bit. Prior to COVID, when I told somebody I was an epidemiologist, they assumed I was like a skin doctor or
Mhm.
other type of doctor, and I'm like, no, no, I'm
No.
not. um, but now people know what my job is, and
Mhm.
they think it's very cool and have a lot of respect for it, which I definitely appreciate. But there's also a lot more scrutiny associated with that as well, because we're getting a bit more attention. Um, but I like it. My day to day hasn't changed much aside from being home most of the day, um, from COVID. For the people who actually, I didn't participate in the COVID response that much.
Mhm.
Um, Other people, we hired a bunch of people, and then other people on our team assisted um, as well, especially my boss. And so we kind of you kind of still needed people to cover the other diseases that didn't just disappear because COVID came.
Mhm.
um I was still doing what I had always been doing all along throughout the pandemic, in addition to providing some support for COVID when necessary.
Yeah. No,
Yeah.
I mean, I can imagine the how much work it must have been.
Yeah. Yeah, you have no idea. Like everything was
Insane, I
like,
can imagine.
yeah, just like unbelievable amount of data coming in. Um, because we wanted to track every single COVID case.
Mhm.
Um, and we wanted to do contact tracing for every single one too. Well, that requires a lot of man hours to call up every COVID case and to then call up all of the people they came in contact with
Yeah.
in the previous, you know, during their infectious period. And,
Mhm.
I made phone calls, and, sometimes people are happy to hear from you and sometimes they're really not. So, and we learned a lot from our partners in HIV and STDs about contact tracing and how to be sensitive, um, to the fact that, people, you're kind of the bearer of bad news.
Mhm.
Uh, I mean, it's not the worst news, but it's definitely not great.
Yeah.
But we did our best. I mean, were there cases that were missed? I'm sure there were.
Mhm.
Were there, people that didn't get a notification call? There probably were. But we hired as many people as we could to assist, and we made as many phone calls as we could. And of course, sometimes, people don't want to be found. So, they may not have a working phone number um, that we have, or the person that was ill may not know their phone number or their full name. So we might not have found some of these people in the first place.
Yeah.
Um, but that's all part of epidemiology, is trying to track people down, so and make sure they don't get sick, or let them know that they've been exposed and to watch out for symptoms.
Mhm.
Um, so it's kind of how COVID went. It and is to some degree still going. The numbers are much lower now than they were um, a year ago or even 2 years ago. Um, so we're, you know, I'm hopeful that we are on the downswing and that we monitor COVID much more like we monitor flu, which
Mhm.
has we have a different way of doing surveillance for those pathogens. And people can get back to their new normal, I guess.
Yeah. No, I mean, life has certainly changed a lot. Like, people talk about life going back to normal. I'm like, I think this is as normal as it's gonna get
Yeah, yeah,
for sure.
yeah, I think you're right. I mean, for a lot of people, it's life has been forever changed, whether it's your job going from in office to remote, or um whether it's masking when you're around large crowds of people, or in tight settings or something,
Mhm.
or when you're ill. We realized that some places, you can't everyone can't stay at home when they're sick. It's not feasible for everybody.
Yeah.
So a mask, or wearing a mask to protect yourself and others, um, is the best compromise that we can come up with, um, especially for respiratory diseases.
Mhm.
So it just kind of changed a lot of things, and it has people looking at things differently, at every level. So, which could be a good thing. Um, Hopefully, I'm optimistic that public health will get its due,
Mhm.
um, and that people will recognize. When I say people, I'm more referring to, like, not the general public, but like policymakers and things like that,
Mhm.
that will recognize that I mean, we've always been around, and it's easier and it's cheaper in the long run to prevent people from getting sick than it is to treat them after the fact. um because hospital bills are crazy expensive. That's one system. That was one class that I took in grad school that I really, really stuck with me, was healthcare finance. And it just showed you the ins and outs of insurance companies, and how they make their money, and
Mhm.
how they really profit off of the sick. Um, and it really opened my eyes, especially because I was going through an illness at that time. So I was just like, oh my goodness, this is crazy.
Yeah.
Um, and but we need them. We need our doctors and nurses and whatnot. Do we need health insurance companies? That's that's a question for a politician. But
Mhm.
um I do think they serve a function. I don't know that they need to make as much money as they do.
Mhm.
uh, but it is what it is. But I do feel like public health can play a role in lowering the cost of healthcare if we were allowed to.
Yeah.
Yeah.
No, I totally agree. I mean, considering I don't wanna get this wrong, but I believe that I mean, there are a couple countries in the world that have totally free public health care,
Hmm. You're right.
and I think that's something incredibly cool, and Do I think that America is gonna get there? Probably not, realistically, but it
Mhm.
would be really cool that maybe one day it just can change.
Yeah, I definitely see our we study different, like Japan has absolutely free public health care. We studied our different healthcare systems in different countries, and I see America being the most like if we were to make some changes, I could see us most like France, which has a public option and a private option.
Hmm,
So, public option is given to everybody. It's your basic health care, almost like your like Medicare or Medicaid, but for everyone. And then they also have kind of your what they call like Cadillac care, which is kind of boutique medical care. So if you wanted like plastic surgery or, something that may be elective that maybe isn't necessary, you
mhm,
could buy insurance to cover that, but it would be completely out of your own pocket. Whereas
hmm,
anything that was deemed medically necessary was covered by that public option. So something like that, I think maybe we could stick with. And then
mhm,
the prevention option could be helped by our public health professionals. So, I mean, I'm not a nurse, but we do have public health nurses that do everything from routine exams, like dental exams,
mhm,
physical exams, and things like that. Um, and they cover they cover like women's health exams and things like that. um, a lot of them are placed at health departments in different counties, and
mhm,
so you could go to the county and get this used to be how it was. You would go and get your vaccine or your routine medical exam at your local health department, and that was that.
mhm,
Um, and you didn't have to worry about a trip to the doctor. You got all of your preventive care through public health at no cost or very low cost.
yeah,
But all that went away, and I'm not really clear on why.
mhm, yeah,
um, but I suspect it had something to do with the money that could be made off of privatizing the system.
possibly,
But it definitely was beneficial because it helped, you know, keep Americans healthier. They were getting routine checkups and not delaying medical care because they didn't have insurance or they're underinsured or they couldn't get in with a doctor. Like public health filled a need there, and
mhm,
we still have that need, but we don't. Public health no longer has the infrastructure to facilitate that anymore. So,
yeah, no, I believe that it probably did have something to do with, income and money more than likely.
mm,
Just in general, that's sometimes just kind of what most things circle back to.
yeah, yeah.
Um, but yeah, also, this Zoom meeting is about to end, there's a little timer, so we
Oh,
might have to start one more.
okay,
It'll be the same Zoom link, though.
okay.
Okay, cool. Hello again.
Oh, hello.
Okay, so, what do you find most interesting about the work that you do?
um, the work I do specifically, so I really loved microbiology in undergrad and in grad school. Not enough to want to be a microbiologist,
Mhm,
but I enjoyed learning about infectious disease, how the body fights it off, and you know, how we transmit disease to one another. That's always been very interesting to me. And the fact that I get to work on some of the most, I don't want to say most, and I don't know that it's good that I have a favorite disease, but I have diseases that interest me significantly, which are invasive bacterial diseases, which are diseases that get into your bloodstream and cause infection. They can be extremely severe. And my favorite is Neisseria meningitis, and it is one of the diseases that causes meningitis. And meningitis is inflammation or swelling of the meninges, which is this sac around the brain. Um, and when it swells, obviously you can get brain damage and all kinds of things. Like, it's a really horrible disease,
Mhm.
but it's very fascinating how people get sick, because some people are carriers, meaning they have the disease, but it doesn't make them sick. And they can actually transmit it to other people who are vulnerable. And those people will go on to develop disease. And so I find it cool that it's my job to, once one person has a disease, to go in and kind of prevent all the people that they came in contact with from getting that disease. So, and the way we do that is our district partners talk to a case and they say, okay, who all have you had close contact with in the past 7 days? And we get a list of names, and all those people, it's basic phone calls and legwork.
Mhm.
Call them up and we say, okay, you need to take this antibiotic immediately so that you don't get sick.
Yeah.
And each case is different. Like, there's no meninge case that is exactly like another one. They
Mhm.
all different, um, different characteristics that make them unique. Um, but we do our best to make sure that people around us or people around that case don't get sick. And I think that's just a really cool thing to do. Is I mean, I'm not a doctor, I'm not a nurse,
Mhm.
definitely play a role in making sure people don't come down with the disease that could potentially kill them.
Oh,
Uh,
absolutely.
I think that's fascinating. I I don't know. I didn't really, I kind of took a not a different path. I didn't really plan on, falling in love with this particular field of
Mhm.
infectious epidemiology in particular. Um, I've also done some work in HIV and healthcare associated infections, which is also really cool. With these, my work with healthcare associated infections was super cool because we were working with superbugs. So those bugs that are like resistant to all antibiotics. So there's nothing we currently have that we can give people who come down with these medically to make them better. We can only support them and hope that their immune system is strong enough to fight it off.
Mhm.
Um, and it's and the reason these bugs even exist is partially our fault, from overusing antibiotics, which we're trying to be better about, and from the fact that no new antibiotics have been released in a long time.
Mhm.
So it's kind of a bunch of factors going in, but it's such a cool, niche area. So yeah, I really enjoyed my time with healthcare associated infections as well. But I I absolutely have adored my time with invasive bacterial diseases and the emerging infections program.
No, I fully agree. Like, though you are not a doctor, though you are not a nurse, you still play an incredibly important role
Mm.
in healthcare. Um, because I'm not 100% sure, but I do believe doctors, they kind of just like write down the symptoms and then that all goes to you, right? And then you try to figure it out.
So doctors will document all of their information and all of the information for a patient in a medical record, and we will request that medical record, and we'll do a review of all that information and try and put together the puzzle piece of of you know where this person got this disease from, especially certain types of diseases which are really rare.
Mhm,
Like coccal disease is pretty rare. Um, some other diseases that are associated with like animals can also be fairly rare. Um, so we we get the medical record and we review it for all the information we need to kind of answer all the relevant public health questions to make sure that this is not a threat to the population at large. Um, how infectious is this disease? How fast does it spread? Does it spread from person to person? Can it be uh is it airborne? Is it foodborne? Is it waterborne? Those are all, questions we have to ask when we're trying to figure out, some of these mystery illnesses. And of course, we work with our partners at CDC to kind of figure out what some of the stuff is. Because sometimes doctors reach out to us and say, we have a case of infectious disease and we don't have a diagnosis that fits. We've run all the tests, nothing matches. We don't know what to do. And then they'll send a sample of that person's blood or, whatever bodily fluid to our state public health lab.
mhm,
We'll analyze it for everything that we know. And then if that doesn't work, then CDC will analyze it for everything that they know.
mhm,
Um, and we'll try to work from there to figure out what it is. And meanwhile we are interviewing family members and close contacts and trying to make sure that they don't have any symptoms, and that if anything comes up, that they communicate with us or that we're monitoring them appropriately.
mhm.
um, and we will try our best to figure it out. Sometimes we do, sometimes we don't. Sometimes, it's just a disease of unknown origin, or we haven't classified it yet, or what have you. Or sometimes it's just something routine that just presented differently than usual, and that could be something about that person. So yeah, but we have epidemiologists that cover, invasive bacterial diseases, which is me, to rabies, which is my colleague, to um, flu, what else? STDs, all kind. If it's infectious and can pose a public health threat, we are on the case.
No, like, I didn't exactly so I was just really curious because I didn't know if y'all only specialize like if how do I word this? If like only a couple people like work on different ones or if you all work on the same one. So that helps.
Yeah, yeah. So I have respond like a couple people might work on the same group of diseases. Like we have them broken down into different categories, and we are on different teams, so to speak. But a couple people cover the foodborne diseases, like all of them. And then within the foodborne diseases team, one person might work on salmonella and shigella, another person might work on campylobacter, another person might work on listeria. So it just depends how it gets broken down. But we cover, as a unit, we cover all of the infectious diseases that are reportable to us. It's just different people work on different ones. And we had quite a few people working on COVID and flu. And we still have a lot of people that are going to be working on those conditions, but it's fewer than we had at the height of the pandemic.
Mhm.
But I think, I think people envision the health department having tons of people to cover all these different diseases, but we don't. It's usually no more than one or two people covering maybe 4 or 5 diseases.
Mhm.
And that's just how we're set up in Georgia. In other states, it could be differently. Um, and the same is true at CDC. I think people think they have dozens of people covering, one or two diseases, but the teams are not that big.
Mhm.
Some of the HIV is probably one of the larger teams, but they're broken down even further into different categories. Like you've got global HIV/AIDS and domestic. Um, so it just kind of depends. You got program personnel, you got EPIs. So
No, you have a bunch of different like teams, so to say, for the different ones.
yes, yes.
So I was wondering, what has been the hardest part about your profession?
The hardest part. Um, well, up until COVID, I mean, the hardest part was feeling like we didn't have enough help to
Mhm.
to do the work we needed to do. I mean, we got the important things done for sure. And it might be a little while, but we got the less important things done too.
Mhm.
uh, they had to be completed. We just had to strategize and prioritize and be strategic about how um, we, made things happen. Since COVID, we've gotten a lot of interest in people wanting to work at the health department, and we've got a lot of interest in people wanting to provide support. And so even me, I felt like I've had a lot of help, because one of a big component of my job is medical record reviews. And
Mhm.
they are, some of them we get via fax, some of them come with like as a CD, some of them come um, as paper, as snail mailed to
Mhm.
us. So in a big, huge box, and myself and others on our team have to go through them manually and collect the information and collect and enter that data into our system. And it can be tedious, and we have to train people on how to do it. And it can be challenging to get people up to speed on how to collect the data properly.
Mhm.
Uh, so it's a little better now. I feel like I have adequate help to assist with various tasks. Some stuff I'm stuck doing because I'm the only person that knows how to do it, uh, which is an error on my part, because I should show someone else how to do it, so I'm not the only one that knows.
Mhm.
But um, I think I think it's gotten a lot better. One interesting thing that happened during the pandemic was a lot of the other diseases, not all, declined. And we think that has a lot to do with the fact that people were isolating themselves.
Mhm.
And so, don't, for diseases that spread from person to person, um, when people aren't in contact, they're not spreading the disease. So the numbers go down. But once everything opened back up, the numbers have come back.
The numbers have spiked a lot.
So we are, yes. um, so it's one of those kind of catch 22s. It was nice while it lasted, and you want the disease rate to be as low as possible, but you don't want people to not live their lives.
Yeah.
So
No, I totally get that. I totally get that. Like, I mean, we need the cases, and not because they're not high right now, I don't believe.
the
Um,
causes are declining,
mhm,
and not everywhere, not
not
everywhere, and
everywhere.
they're definitely way lower than where they have been.
Yeah. No, they're not the lowest that it could be, but they're not spiking so much that we're back in a lockdown.
Exactly,
Yeah.
exactly. So, um, I'm I'm grateful for that. Um, so yeah, but that's pretty much been like the hardest thing is just having the having the bodies to cover all the work that needs to be covered.
Mhm.
Um, you know, I don't know how we fix that. I think there's been a spike in the number of people that are interested in public health, which is good, but we have to wait for those folks to kind of get through the education process of, becoming not a, you don't have to be an expert to work in the field, but just
But you definitely need to
being,
have some experience,
yeah, yeah, you have to have some experience and some basic knowledge of public health to work in public health, ideally.
ideally. Okay, so this is the part of the episode where these questions are aside from your profession.
Okay.
Okay, so if you could add anyone to Mount Rushmore, who would it be and why?
If I could add anyone to Mount Rushmore, who would it
Absolutely
be and
anybody.
why? Um, Gosh, I have I have two competing thoughts in my head.
Okay.
So my thought was I would add my mom to Mount Rushmore.
Mhm.
Because she is just an amazing, amazing woman. And she is about to retire from her career. She actually works at CDC now, not in the public health side.
Mhm.
Um, but she's about to retire. She was a military woman, not a military wife, but she was actually in the military herself. Was a military wife too, because my dad was in the service as well. Um, and she raised four children on, you know, while, having to have my dad be deployed to wherever or her be deployed to wherever and us moving around all the time. She raised four of us. We turned out fine. Um, and I just think she's just like, there's not anybody that has come into contact with my mom that doesn't absolutely love her.
Mhm.
And she's so just she's just so incredible, and I think that would be the best way to honor her forever and ever and ever, would be to have her face immortalized on um on the side of a mountain.
Yeah, I fully agree. That is such a sweet answer. I absolutely love that.
Thank you. Yeah, my celebrity answer, I guess, would have been Michelle Obama, because I like her as well,
Mhm.
for a lot of the same reasons. She's just so graceful as well. But my mom is close to my heart, and I know her personally. I don't
Yeah.
know Michelle.
Okay, so our other question is if you could bring back any fashion trend from any time, what would it be and why?
Hmm. Let's see. What would I feel like there were a lot of questionable fashion choices back in the day. Um, I don't know. I feel like maybe the style from like the 70s, kind of that flower child vibe with
Mhm.
the flared out pants and the big afros. I mean, a lot more people are wearing their hair naturally curly these days, especially people of color. Um, but I think that would be such a fun, like, kind of jazzy era to to rock.
I completely agree. I absolutely adore that era of just everything. Like from clothes to how people wore their hair and how they styled it to just the whole vibe of it all.
Yeah, yeah,
No,
cool.
that's incredibly interesting.
Yep.
So, this is the tagline, this whole show. Ashley, what do you geek out about?
Ooh, so I two things,
Okay.
and your mom can probably attest to one of them. So both. So I am an avid reader. Like, I read constantly, and not just like textbooks related to public health or anything like that, but I love everything from I love fiction, and I love, like, I'm reading a book now called Legend Born, and it's
Ooh.
just this fun YA fantasy. And I absolutely love it. I just got done reading another amazing book called Small Great Things, which had me like crying, and just it was heart-wrenching, but it was really good. So I will read whatever. So books, I am a huge fan of books. Because I'm a busy mom and career woman and all that other things, I kind of cheat and listen to audiobooks so that I can do other things while I'm reading, so to
Yeah.
speak. But when I have an opportunity to sit down with a physical book, I will. The other thing that I'm passionate about and geek about are musicals.
Ooh.
I Broadway, your my high school bestie, Robert, who your mom also knows.
Mhm.
Um, um, he he and I like directed a show in high school, and it was incredible. I mean, he's actually like a Broadway producer now, so he pursued that passion. I kind of stuck to science, which was my passion as well. Um, of, of hearing musicals and just celebrating all things Broadway, and I love it.
What is so since you love musicals, what is a musical? Have you seen any performed like a Broadway musical? And if like do you have a favorite or one that you would like to see? Like one that you is your dream to see?
So my favorite musical is a musical called Aida,
Mhm.
and it's this beautiful love story, and it's got these incredible vocals from a talented cast, and that's my favorite. The first musical I saw was Rent, and it just it like it blew my mind. Like I was like, this is phenomenal. And for then on, I've fallen in love with everything from Hamilton to Funny Girl. Like I love it all. And yes, I saw Aida,
Mhm.
um, York. Um, I what else have I seen? I've seen Wicked in New York,
Ooh.
which was an incredible experience. I saw that with my college roommates, and it was fantastic. Um, and I'm trying to think of what else. I've seen a lot of stuff here in Atlanta at the
Mhm.
Fox. So I saw Hamilton and some other things as well. So in the Heights, um,
Ooh.
all very good.
No, I wouldn't see, I love listening to musicals, I love watching musicals. I could never personally be in one. I have I am not I'm very as you may know, I'm very different, or as you know about my mom, I'm extremely different than my mom in that way. Um, 'Cause she, from what I've heard, is, like, one of the biggest theater kids that I know personally, or was
Hmm.
one, but, like, the most
Yeah.
I will do is dance on a stage because I used to be in dance. I will not sing on a stage, I don't even like talking on a stage, but I will listen to musicals daily. Like, I love Hamilton, I love Mean Girls, I love Beetlejuice, um, I love Hairspray. Hairspray is probably one of the first musicals I fell in love with that wasn't, like, Disney.
Yeah, yeah. Yeah. I yeah, I recall your mom being very theatrically driven. We were both in shows together and everything.
Mhm.
I would not be in a musical because I can't carry a tune in a bucket. So
Oh, me
I
either.
sing whatsoever at all. And I mean it's perfectly fine. You know, you can dance in musicals and things like that, but usually if you're going to be in a musical, you're going to be doing some singing.
And acting and singing and all that, yeah.
The acting part doesn't bother me so much, but
Mhm.
the acting and the dancing I can swing, but the singing, absolutely.
No. I can dance, I can act to a certain degree, considering it's just, "Oh, here's your script," you know? It's portraying it that I guess
Right.
is more difficult, but no, I will not be on a stage singing, ever. Absolutely never. So, I wanted to say a huge thank you for being with us today. Um, and just thank you for giving me your time. This was incredibly interesting, and I definitely learned a lot about the public health workforce and everything.
Yeah, it was absolutely my pleasure. I've been looking forward to this all week. I was so excited. Um, so yes, I am thrilled that you invited me, and I was happy to talk about one of several passions that I have. So
No, yeah, absolutely. Thank you so much. Like, this has just been a great evening for sure.
yeah, yeah. So thank you very much. And I look forward to seeing the podcast when it's up.
Yes, thank you. All right, I'm gonna do my little outro.
Okay.
Um, Thank you everyone so much for listening, for watching, um, wherever that may be. And yeah, I hope everybody has a great week, and I will see y'all next Friday. Bye, guys.